Thanks for joining us and welcome to today's webinar, Making Strides, a look at our 2016 state report cards. My name is Michelle Lieberman. I'm the Technical Assistance Manager with the Safe Routes to School National Partnership, and I'll be your webinar moderator today as well as one of the presenters. We're really excited to have all of you with us today as we share our first ever state report cards on support for walking, biking, and active kids and communities. First, a bit about the Safe Routes to School National Partnership, in case you're not familiar with us. We're a national nonprofit organization that improves the quality of life for kids and communities by promoting active, healthy lifestyles and safe infrastructure that supports bicycling and walking. And equity is always at the forefront of our work. Before we get started, I want to point out a few housekeeping items in GoToWebinar. To the left is the GoToWebinar viewer through which you'll see the presentation. And on the right is the control panel where you can raise your hand, ask questions, and select your audio mode. Please note that the control panel will collapse automatically when it's not in use. So if it disappears, just open it up and click on the View menu and uncheck Auto Hide Control Panel to keep it open. There are two options for listening to us today, telephone and mic and speakers. If you're having sound problems with one selection, try the other option. We'll also do our best to field any issues. Just send us a chat message. And even though all of you are muted, we really want to hear your input. You can use the questions box to ask speakers questions for the Q&A portion of the webinar, and we'll try to answer as many of those as possible in the time. Also look to the checkbox for important links to materials, the references that are referenced during the presentations. And if you're looking for the recording of the webinar afterwards, I'm sure you'll want to be able to watch it again and share it with friends and colleagues. So it can be found on our website, saferoutespartnership.org. And if you click on the resources and the top header and then webinars on the left menu bar, you'll be able to get the webinar recording in about a couple of days. And now for our speakers, we have a great group of people here with us today. We're going to start the webinar with a presentation on the state report cards given by Sarah Zimmerman, Margot Pedroso, and myself. Sarah serves as Program and Policy Director for the National Partnership. She works to support communities in obtaining resources and advice they need to increase physical activity and safe walking and bicycling for children and adults. Sarah oversees the work of the Program and Policy team in providing high-quality technical assistance and advice to low-income communities and other communities of different sizes and in different regions across the country. Margot Pedroso serves as the Deputy Director for the Safe Routes to School National Partnership, and Margot manages government relations, grassroots lobbying, policy research, and analysis to advance safe routes to schools nationally, and assists the Director with partner outreach, fundraising, and strategic planning. She leads the National Partnership's legislative strategy on Capitol Hill and with federal agencies. And again, I'm Michelle Lieberman. I am the Technical Assistance Manager for the National Partnership. Following the presentation on the report cards, we're going to hear from Jim McGowan, Senior Manager of State Advocacy with the YMCA of the USA. And Jim is going to tell us how the Ys, and in particular the Minnesota Alliance of Ys, are using the report cards. Jim is a tireless advocate on behalf of people at risk of or living with diabetes and other chronic diseases. He has played a leadership role in many policy and legislative successes in his home state of Minnesota and at the federal level. So prior to joining the YMCA of the USA, Jim served as the Executive Director of the Minnesota Alliance of YMCAs. And before that, he was the Midwest State Advocacy Director at the American Diabetes Association. So with that, I'm going to go ahead and turn it over to Sarah to give us an overview of the report cards and go into the first topic section.
All right. Hello, everybody. Happy to be here with you today. We're going to start with an overview of our state report cards report. And I just want to start off by letting you know a little bit about the overall goal of the state report card project. We wanted to provide a snapshot of how supportive each state was and is for walking, bicycling, and physical activity for both adults and children. Um, just to let you know a little bit about how this project came to be and kind of what the overall vision is for it. For a long time here at the Safe Routes to School National Partnership, we wanted to develop state report cards that really assess how supportive states are of safe routes to school, of walking and biking in communities generally, and of physical activity opportunities for adults and children in communities. We've always thought this was a really important goal because we want to be able to acknowledge the strengths of states, the great things that are happening in states that really help make kids and adults healthier. We want to also be able to hold states accountable and kind of point out to them where there are places where they could really do better. And then we also want to help advocates and government folks in different states have more of a sense of what the standard is that we expect for states across the board. What's a more consistent measure for what makes a state that's really doing a great job in this arena of being supportive of walking, biking, and physical activity versus when is a state really need to step up its game a little bit. So all of those reasons meant that when YUSA, when the YMCA of the USA came to us with funding from the Centers for Disease Control, proposing that we work together on some materials in support of the Surgeon General's call to action to promote walking in walkable communities, this was really a perfect opportunity for us. We were excited to be able to support the Surgeon General's call to action, and we were also really delighted to be able to develop these report cards that are going to help people understand and advocate within their state for more support at the state level for physical activity. So we've really enjoyed being able to work very closely with YUSA during this whole report card development process. They were instrumental in providing us thoughtful input and feedback at each stage on the approach and the components of the report cards. And we've also been really excited to get to work closely with the state YMCAs to support the efforts that they're making to make change around these specific policy areas that are called out in the report cards. So what does the report include overall? It has research and citations setting out why physical activity and walking and bicycling matter so much. So it's kind of a handy resource in that sense. It also has a rationale for why state report cards. Why is action at the state level so important for really making change? Why is that an important level of policy setting? It contains a detailed explanation of the scoring of the report cards, the specific indicators that we looked at, where we got the data from that fed into the indicators, and the core topic areas. And then it contains the report cards themselves, so you can look through and see for each state how did they do on each specific different area. So where can you find the report card? You can either follow this little bit.ly link at the top that takes you directly there, or you can go to our homepage, which is saferoutespartnership.org, and scroll down, and a link to the state report cards can be found right there in the featured section partway down on the page. That link brings you over to this page that shows the map of how each state did overall on its state report card. And if you click on any specific state on that map, it opens up the report card for that state. You can also click on the image of the report over on the left, and that will take you to the full report. So not the specific report cards, but the full report with all the additional information that's in it. Now, how did we do the scoring for the report cards? Each report card includes a score for each of 24 separate indicators. And we're going to be talking to you later in this presentation about all those different indicators and kind of helping you understand more what we really looked at and why we chose the topics we did. The 24 indicators are grouped into 4 core topic areas, and most of those core topic areas also include subtopics under them. The indicators are mostly looking at state-level policy and implementation around specific policies that have been adopted or funding. But there are also a few measures that we include that summarize the reality on the ground, and those look at access to recreational facilities and safe walking and biking facilities in the states. Most of the indicators are scored from 0 to 5, 10, or 15 points. But for a few of the indicators, we had a situation where a state might receive negative points if they took a very detrimental action. Overall, there are 200 total points that are possible across all of the indicators. And when you look across the states at the actual scores that states received, they range from 40 points out of those 200 points to 161 points. So some room for improvement even in the very highest scoring states, and everybody scored some points. So some good actions taken in every state. We wanted to use asset-based scoring, so we did not have that sort of A to F style report card grading, which makes you feel kind of crummy if you get the C or D or F, because we wanted to acknowledge the progress that each state had taken, even in areas where there was a lot more room for opportunity, and also what they could do. So the categories that we chose were lacing up for when states had just taken very little action or really just getting started in a specific area. Warming up, which is when the state had made some significant action but really had a lot of room to go. Making strides, when the state had taken some significant steps. And then building speed, when there was really strong actions or strong policies that had been taken in a state. So let's walk through a report card just so that we kind of look through it together and understand what's covered in it. We're going to use Minnesota as our example. It was one of just a handful of states that got an overall grade across all of its different core topic areas of building speed. So you see at the top the state is listed along with the icon and the color for their overall score. So here it's blue, and they have the building speed icon. There's also a number, which shows how many points were achieved out of the 200 possible points. For Minnesota, you see we've got the building speed icon, and they scored 152 out of 200 points. Now looking down the left-hand side, you'll see that underneath that top section, we have the core topic areas listed for each state, and they're in all caps. And then we have subtopics in most cases. The state physical activity planning at the very bottom was the only area in which we did not break out subtopics. And then each of the 24 indicators is listed kind of in the middle of the whole page, and it has a just has that short descriptive language so you kind of get the quick gist of what that indicator was really about. Now looking over on the right, you see that for each core topic area, a grade is given. So there's the scoring icon and the points earned. And the icon's placed on a scale, so you can just see on that glance how they scored against the possible total. For each indicator, we indicate the points that they achieved out of the total possible points for that indicator. And then at the bottom of each section is the total points earned for the core topic area on those matters, that subtotal. So how did the states do? As you see, there are only 2 states that were in that lacing up category, the sort of lower category, where they had taken a few actions, but not really a lot of substantial actions. And there are only 3 states in the building speed category, the highest category, where there had been really substantial actions taken. So what that meant is that clearly most states are in the middle. They've taken some actions that are fairly meaningful to support physical activity, but they still really have considerable room for improvement. Another interesting thing that we noted as we looked at all the different states and how they scored was that there wasn't a single state that got the same scoring category in all 4 of the core topic areas. So there was a lot of variety in progress on physical activity even within any given state. So with that said, we're now going to go through each of the core topic areas and describe the indicators and what we looked at in a little more depth. So let's start with core topic area number 1, complete streets and active transportation. So for this core topic area, we're going to use Georgia as our example state. And so the complete streets and active transportation core topic area is the one that really delves into the friendliness of a state for active transportation. So in this section, we are looking at the policies, design guidelines, and goals that states have adopted that affect whether or not the state is really open to and supportive of bicycling, walking, and transit. And these are areas that are primarily affected by a state's Department of Transportation. There are 3 subtopics within this core topic area: state complete streets policies, designing for active transportation, and active transportation goals. So what's the research behind these measures? Why did we look at these specific things? When we look at the research, we see that it shows that active transportation is really a key strategy for making sure that children and adults can get the recommended amounts of daily physical activity, which most folks in this country are not getting. So we wanted to look at active transportation for a starter. We also see that about 60% of people who walk on a regular basis meet the physical activity guidelines. So they do that either by walking alone or in combination with other forms of physical activity. So that's really a lot of support for the idea that we want policies that are supportive of walking. Research also shows that the way streets are designed can either encourage or discourage. It can lead to higher or lower levels of active transportation and physical activity. And studies also show that people who have access to more and better quality sidewalks are more likely to walk, and people with access to bicycle lanes and paths are more likely to bicycle. So that was why we really selected these items. Now let's start with the subtopic of complete streets policies. So first of all, what is a complete streets policy? A complete streets policy is a policy that ensures that all new construction and renovation of streets create streets that are safe, comfortable, and convenient for everyone who uses them. What do we mean by everybody? We mean that we're not designing streets just for cars. We're looking at people who are walking and biking, people who are driving, public transportation riders, people with disabilities, and people of all ages. We want streets to be safe for kids and for older adults and for everybody in between. So, of course, as with any policy, some policies are stronger and weaker. So how did we evaluate complete streets policies for purposes of our report card? As you see under the indicator section here, we looked at 3 specific indicators. And of course, it's worth pointing out that there are a large number of potential provisions and components of a complete streets policy, and many of them are very important. So in no way are these 3 indicators the only thing that we want to consider when it comes to a complete streets policy. But we chose these 3 as ones that really kind of summarized and provided a quick synopsis of whether a state was really taking a strong stand on complete streets. And as you see, Georgia did really well on all 3 of these. So the first one is, has the state adopted a strong core complete streets commitment? And this is looking at, did they adopt a commitment that really requires a change in how streets actually get built, rather than just sort of an aspirational statement or no policy at all, as is also common for some states. And here, Georgia gets 15 points out of 15 points. Their policy included mandatory requirements for clear actions. The next indicator looks at whether or not the state policy addresses additional jurisdictions, not just the state Department of Transportation or the state actions when the state itself is building streets, but does it also address counties and other jurisdictions. And here, Georgia gets 5 points out of the 5 available because their complete streets policy addresses the counties and municipalities in addition to the state level actions. And then the third indicator looks at the implementation of the state complete streets policy. And Georgia gets 10 points out of the 10 available points because they had 2 or more clear implementation steps, so that they're spelling out how they're going to actually put that policy into practice and make sure it doesn't just sit on the shelf and not get implemented. So, so that was the first subtopic, complete streets policies. Now let's talk a little bit about the second subtopic, designing for active transportation. Now this subtopic is looking at whether or not states are allowing and encouraging modern approaches to designing streets. And we evaluated this through whether or not states have adopted the NACTO design guidelines. Now what is NACTO? NACTO is a nonprofit association, the National Association of City Transportation Officials, and it represents large cities on a variety of different transportation issues. And one of the things it does is develop very strong and thoughtful and progressive design guidelines. So our indicator here looked at whether or not a state had adopted or endorsed the NACTO guidelines, either the Urban Bikeway Design Guide or the Urban Street Design Guide. And here, Georgia got 6 points because it endorsed the Urban Bikeway Guide, but it did not endorse the Urban Street Design Guide out of the possible 10 points that were available here. Now, just a little bit more information on what these guides really are. The guides outline recommendations for building bicycle and pedestrian-friendly facilities such as bike lanes, signage, park elements, and the like. And the Urban Street Design Guide is really focused on what kinds of design guidelines, how do you design streets in ways that make them really great public places. And that requires things like making them really walkable so that people are really interacting with each other. They're safe. They're places that encourage people to be there and be enjoying the space. the Urban Bikeway Design Guide, provides really strong modern guidelines for bike facility design, something that we are really starting to see in many of our communities nowadays. And one of the things that's really worth noting about these different guides is that even though NACTO has, city right there in its title, these guidelines, these design guides talk about urban design, they're really not just for urban states. Places like Minnesota and Utah, where there may be only, not as many large cities, a much more larger portion of the state that's very rural, are still adopting the guides as guidelines that can be useful across their states. It's also worth noting that that the Federal Highway Administration announced support for the use of these NACTO guides in 2013, and they've been recognized as design guidance for federally funded projects as part of our current transportation bill, the FAST Act. So that just goes to show these are, it can be kind of confusing that they're proposed and developed by a private nonprofit organization, but they have some very strong official support. Now, those developments and the actions of state departments of transportation in endorsing these are really key, because without the endorsement of these guides, oftentimes cities, towns, and state road engineers don't have the flexibility to make roads safe and comfortable for walking and biking. So this isn't just kind of an optional, interesting thing. It's actually really crucial to these goals of walkability that we've been talking about. Let's move on to our third subtopic. So the third subtopic is active transportation goals. And here what we're looking at is whether or not a state has published goals to increase walking and biking and to decrease fatalities. These are important as public commitments to really doing better in these areas. They provide accountability, and they can often be found within a highway safety plan, a bicycle pedestrian plan. They could be just standalone goals, but we see them not as frequently that way. And they can be in any other health or transportation statewide plan. So, so what do we see for Georgia? Georgia got 10 points out of 10 points for the first indicator, whether or not the state has adopted goals to lower walking and bicycling fatalities. Because it's showing that commitment to increasing safety by adopting a goal around both decreasing the fatalities for walking and for bicycling. And it got 5 out of 5 available points for adopting goals to increase the walking and biking mode share, because again, it's adopted goals to increase both of those mode shares. And with that, let us pass it over to Margot to talk about our next overall area.
Great, thank you, Sarah. Let me just get my slideshow going here. I'm Margot Pedroso, and I'm going to walk you through the second core topic area, which is safe routes to school and active transportation funding. So in this area, we'll be looking at Alabama, which was one of the top scoring states in this section. And Sarah already briefed you on the research behind why walking and biking is important for health. And in order for kids and families to be able to walk and bike safely and get that physical activity, they need access to sidewalks, crosswalks, bike lanes, and safe streets. And these types of infrastructure improvements do take funding in order to implement. So this section examines federal and state transportation funding that supports biking, walking, and safe routes to school initiatives and infrastructure in local communities. And it primarily looks at state implementation decisions, which have a big impact on whether or not you can readily access funding for these types of initiatives in your state. And if you're looking to make improvements in your state's ranking in this area or impact the decisions that they've made, you would be engaging with your state Department of Transportation. As you can see, there are 3 sections to this topic area, and I'll go over each in a little more detail in the following slides. And I just want to encourage you to always go back and reference the Making Strides report that accompanies the report cards, as it has much more detail on the specific scoring detail. So for example, if your state got 5 points out of 10, the report will spell out for you exactly what 5 points means. And the data for most of these indicators comes from research we did on each state Department of Transportation's implementation practices, which we confirmed through phone or email follow-ups with the state Departments of Transportation. So the first section within this topic area is on active transportation funding. And what we're looking at here is the Transportation Alternatives Program, or TAP, which was created by Congress in 2012 when they merged together 3 separate funding programs that support safe routes to school, biking, and walking. States receive anywhere from $3 to $80 million a year from TAP, and it's the major federal source of transportation funding for these types of initiatives. And even though the federal government is making this funding available to states, they have a lot of discretion, the state departments of transportation do, in how they get the funding out the door and when they hold competitions in order to access the dollars. So we assess states on the accessibility of the TAP funding, which is dependent on their implementation decisions. So in the first indicator, we're looking at whether or not a state has transferred money out of the TAP program. Under federal law, states are allowed to take up to half of TAP dollars and move it over to fund roads and bridges. Obviously, we don't want states to do that because that decreases the pot of funding available for biking and walking. The second thing that we're looking at is whether or not the state is actually moving forward on making the funds available, whether or not they've held a competition and chosen the projects for at least 2 years' worth of TAP money. Thirdly, we're looking at obligation of state-controlled funds. Obligation is basically a technical term for the contract and process that a state has to go through once it chooses a grant in order to get the money out the door so that the project can actually be built. So you want a high number there, which shows that the projects are actually moving forward. And then the last 2 pieces look at whether or not the funding is accessible to high-need communities, whether that's through matching dollars to help high-need communities access the funding, or it could be scoring criteria or setting aside a portion of TAP money for high-need communities. So looking at these 5 factors, you can get a good sense of how your state is doing in implementing the TAP program. So for Alabama here, you'll see they scored well in that they have not transferred any money out of TAP, and they have held a competition and awarded at least 2 years' worth of funding. However, it would be good for them to speed up the obligation a little bit more so that these projects can actually get built and start improving safety for folks. And we'd encourage them to add in equity considerations in their process to ensure that the communities that most need these improvements are able to access them. The next section is focused on safe routes to school funding. So this is all about examining the state's efforts to make it safer for kids to walk and bike to and from school. And as mentioned on the prior slide, state departments of transportation have a lot of discretion in how they administer the Transportation Alternatives Program. And one of those discretion points is they can, if they want to, elevate the consideration of safe routes to school projects for TAP. They can hold a separate competition for TAP just for safe routes to school projects. They can add extra points or in the scoring. These types of things would help make sure that safe routes to school projects rise to the top. And we also look at the old federal Safe Routes to School program. It ran from 2005 to 2012, and states received anywhere from $8 to $130 million during that time period, specifically for Safe Routes to School programming and infrastructure. Most states have spent that money. However, there are some states that still have funds sitting around that are dedicated to Safe Routes to School that they have not yet awarded out to communities, and we'd like to see those move forward. And finally, we also look at whether or not a state has provided some sort of state funding stream to support safe routes to school projects. There's only a handful of states that have done so, but we thought it was important to set that out as something we would like to see states do. So altogether, these 3 indicators give a good picture of whether or not safe routes to school projects are able to access funds to increase walking and biking to school and safety for kids, and whether it's a high priority for the state. And so you'll see, looking at Alabama's scores, that they did a really great job in spending the old Safe Routes to School program. They got a 10 out of 10 there. But they are not providing any special consideration for Safe Routes to School projects for the TAP program, and they don't have state funding for Safe Routes to School. So this is something that advocates in Alabama would want to keep an eye on to see whether or not when TAP projects are awarded, do Safe Routes to School projects do well, and whether or not any adjustments are needed there. And the last section is about supportive practices. So this is not about the funding. This is about staffing and support that state departments of transportation provide so that schools all across the state, whether or not they receive funding, are able to move forward on safe routes to school initiatives. So the first thing we look at is staffing. Under the old federal transportation law, state departments of transportation were required to have a full-time coordinator that was dedicated just to safe routes to school on their staff. That is no longer required, but many states have retained these positions. We think they're important because they provide schools and parents with an entry point into the Department of Transportation, and it's a staff person that understands safe routes to school, they understand infrastructure and programming, and can help assist schools with best practices, helping them access funding. And you'll see that Alabama got a 4 out of 5 there, which means that they retained their Safe Routes to School coordinator, although additional duties were assigned to them, so they're not full-time just on Safe Routes to School. And the second looks at whether or not the state DOT has set up a technical assistance center or provides any kind of application assistance workshops. And we find that these are very helpful for schools that haven't yet received funding to help them start Safe Routes to School initiatives and kind of gear up so that they can successfully apply in the future for Safe Routes to School funding. And you'll see that that's an area in which we'd recommend that Alabama make some progress here because they do not have either of these at the moment. So that is the quick overview of the Safe Routes to School and Active Transportation Funding section, and I will hand it off to Michelle to review the next 2 sections of the report cards. Thank you.
Thanks, Margot. Let me get my PowerPoint here. Okay, so our third core topic area is focused on active schools and neighborhoods. And so we're going to look at Indiana's report card as an example for this section. And this is the section where we were able to drill down a bit to more of the neighborhood and school level, which plays a big role in the ability of children and families to be more physically active. And we included a focus on state support for active schools and neighborhoods because we know that living in a neighborhood that has safe places to be physically active and being able to attend a school that provides regular opportunities for physical activity supports a child's ability to meet daily physical activity guidelines. We know that without access to playgrounds, parks, community centers, other places for physical activity, community members are really less likely to be physically active, even if they have the desire and motivation to be so. And of course, looking at physical education teaches children the skills and habits that they need to be physically active throughout their lifetime. And then, while this report primarily uses policy indicators to evaluate each state, this topic does include 2 environmental indicators where we looked at on-the-ground access to parks, playgrounds, and other places where community members can be physically active. The first 2 indicators in this section look at policies around shared use of school facilities. And school shared use agreements open up school playgrounds, fields, and other facilities for recreational use by community members outside of school hours. Shared use provides places for physical activity and other community uses and can be especially critical in neighborhoods that lack parks, playgrounds, or community centers. While shared use agreements are made at the local level, supportive state policies and funding are two of the key ways that help communities overcome fears and challenges around shared use. So our first indicator here looks at whether a state had adopted a policy supporting shared use of school facilities. State laws can make it more or less likely that a school will agree to open up its facilities outside of school hours. So to get 10 points, the state must have adopted legislation requiring schools to allow access to recreational facilities outside of school hours. If they receive 6 points, it means that there was legislation that recommends but does not require shared use, and 0 points if no legislation has been adopted at all. The second indicator looks at whether a state provides funding or other incentives to support shared use. Beyond having a supportive policy, states can provide an extra carrot or incentive, often through funding, to encourage local schools, cities, and other groups to work together to implement shared use. So here we awarded 5 points if a state does provide funding or incentives, and 0 if it doesn't. Next in the section, we looked at if a state had adopted physical education standards aligned with the national standards for physical education. As of 2012, all but 1 of the states had adopted some form of physical education standards, and 43 had adopted standards that were based on the national standards. So just like other subjects like math and social studies, states can adopt standards for physical education. These standards allow for consistency in the quality and even just providing a minimum amount of physical education in schools across the states. So states receive 10 points if they adopted physical education standards align with the national standards, and 0 if they didn't. I want to note that this information was information based on the CDC as of 2012, but since then there have been new national standards developed, and states may be changing the standards to be in line with those. So hopefully our next set of report cards will have the information about the alignment with the latest standards. The next subtopic in supportive neighborhoods for physical activity, we wanted to look at some measures that actually assess the conditions on the ground with an eye on both the youth and the general population. So we looked at 2 indicators. For the indicator on level of access for youth to sidewalks, parks, and community centers, the data came from the National Survey of Children's Health, and it looks at whether the parents answering the surveys found that their children had these facilities available to them. Indiana got a 2 in this section, meaning that somewhere between a half and a quarter of the kids in the state are believed by their parents to have all the features available in the neighborhoods. And for more information about the specific breakdowns and the scoring numbers here, I would refer you back to the report because it has detailed information there. And then for the last indicator here, for the park access indicator, data came from the CDC's National Environmental Public Health Tracking Network, and it looks at the percent of the state's population living within a half-mile, fairly walkable distance of a park, and it's based on park boundary data as well as looking at census data. So Indiana received 2 points here, and that meant between 20 and 40% of its population lives within a half-mile of a park. The last core topic area is physical activity planning and support. And here we're going to look at Washington State as our example. While this is our smallest section, both in terms of the number of points and the number of indicators, can really have a powerful impact on physical activity when a state devotes appropriate attention and resources. So this section is all about the resources and the efforts that state government agencies undertake to coordinate efforts across departments and agencies and plan for strategies to increase the levels of physical activity across the state. These efforts can be led by the governor's office or an assortment of state agencies, and they help raise attention, coordinate strategies, and access funding to physical activity. So I'd like to note that while many states may have obesity prevention or health councils or plans, physical activity is often underrepresented in these larger initiatives. So these indicators score and look specifically at a state's specific focus on physical activity within plans, councils, or staff. So let's look at the first indicator, adopted a state physical activity plan. This would need to be a statewide plan specifically focused on physical activity or a plan that includes physical activity in a substantial way and another state-level plan, such as an obesity prevention limit. States could receive between 0 and 10 points for this indicator. The second indicator looks at if a state hosts a governor's council on physical activity. This is an advisory body that helps elevate the importance of physical activity amongst state departments and state department heads, and ensures that physical activity is considered in state decision-making. So governor's councils can often also typically promote awareness of physical activity out in the communities as well. And then the last indicator looks at if a state has staff focused exclusively on physical activity at the state level, typically within the public health department. Dedicated staff means that there's more staff time spent on physical activity promotion, and that there's staff with expertise in the area within the public health department. So 10 points are awarded here if there are staff focused on physical activity exclusively. If a state has staff that has focused on physical activity but also has other responsibilities, they receive 6 points, and 0 points if there aren't any staff who focus on physical activity. So that's an overview of all the indicators and the core topic areas within the report card. And so I just want to kind of give you some information about next steps. We are developing some tools, fact sheets and tip sheets to assist advocates in using the report cards, and we'll have those up on our website soon. And we're planning to use these report cards as a benchmark. So hopefully we'll be able to develop future report cards every 2 to 3 years that will measure progress over time, and this will be our benchmark year. So with that, I'd like to turn it over to Jim and have him tell us about what the Minnesota Alliance of WISE is doing with the report cards.
Great. Thank you very much. Again, my name is Jim McGowan, and you'll note on the screen that it says that I'm speaking on behalf of the Minnesota Alliance of YMCAs. I've recently made a transition to now being employed by the YUSA in our government relations department doing state advocacy. But it's recent enough that I'm still kind of transitioning roles, and so I'm very much I'm actually located in Minnesota and still very much supporting some of the ongoing initiatives of the Minnesota Alliance. So I'm speaking on their behalf today. What I want to talk about is just how we were able to use this the report card data to kind of focus our approach. The YUSA had received a walkability grant from the Centers for Disease Control in support of the Surgeon General's Step It Up initiative, which is a call to action to promote walking and walkable communities. And so those funds were able to be dispersed to all 50 state alliances within the YMCA movement. And back in earlier, about a couple months ago, at our prior to our national advocacy days, we had a meeting to kind of train us, all of the alliances, on approaches that we might take in order to utilize this grant and promote walking and walkable communities in our states. And there was, in some cases, some states were able to put together events, walking events that got high publicity and really drew attention to the issue of walking and walkable communities. But in our training, we were really encouraged to take a look at the environment of our state and create with these funds more of a sticky solution, something that could really lead to longer-term impact and address some of the needs of our states and communities in terms of improving the walking and walkable communities. So as part of that training, we were then presented with our state report cards. And I was very pleased to see from the start, this was the first map that we saw, which indicated progress in our overall grades. And so I was pleased to see that Minnesota was got a relatively high score. And much of that is due to the coalition work that's been happening in our state. We have an organization called the Minnesotans for Healthy Kids Coalition that partners with the Safe Routes Initiative. It's about 25 member organizations whose mission is to promote healthy eating and increase physical activity to improve health and reduce obesity among Minnesota's children through policy change. And that coalition has been just doing some outstanding work over the last few years, both in terms of policy, but also in terms of promoting additional funding from the state to be able to go out to communities, particularly in active transportation and safe routes to school funding. So much of the credit for the high score that we had really is due to that coalition work, which is continuing. I actually met with them yesterday. So as you saw earlier, our report card came up with a very nice score, 152 points out of 200. But what was really useful to us was to be able to kind of drill down into the individual components of the report to not only see where we've done well, but to also identify where there are some gaps and some areas where that need some continued attention. And so scanning down, we were able to see that within the Safe Routes to School and Active Transportation funding category, we received a couple of zeros under that first subcategory of active transportation funding. And it related to providing special consideration for HighNeed communities and providing matching funds for HighNeed communities. And so with that information, I reached out to I'm just going to move forward. I reached out to our partners in our Healthy Kids Coalition to just kind of talk about this a little bit and try to identify, what were the reasons for those scores? Why is it that especially in light of high scores elsewhere, that we had a deficiency in this area? And what it really seems to boil down to is that our at-risk communities have a relatively low rate of accessing active transportation and safe routes to school grant opportunities. The opportunities are out there, but for a number of reasons, those communities are just not able to take advantage or do take advantage of those opportunities. And so some of the reasons that came up were that there could be gaps in outreach as these grant opportunities are communicated. There may be just more things that we could do in terms of making sure that at-risk communities are aware of them and then apply for them. But in terms of applying, we also identify that for some of those communities, there may be a lack of adequate resources to actually do the application itself. There could be, whether it's staffing or, even just funding to support the application process. There could also be the concern that if a grant was awarded, that there may be administration requirements that just might be beyond the capabilities or expertise of a community. And then the other aspect of the grants is the reporting, which can sometimes be, significant amount of reporting or technical aspects to the reporting that also might make it a little onerous for a community to even considering applying for the grant. So with that information, we reached out to the Department of Transportation. There's a Safe Routes to School staff at our Department of Transportation, and we talked a little bit more about this. And actually, I'm just going to bump back real quickly here. If you look at the second red mark there, you can see that the state is actually providing and got a high mark for the technical and application assistance for Safe Routes to School initiatives. But what we really thought might be useful is to make sure that as those kinds of technical assistance opportunities are presented, that we make sure that we're focusing on high-risk communities or at-need communities. And so what we're doing with our walkability funding is we're partnering with the Department of Transportation to open up a few Y facilities across the state, probably 3 different regions, and we would use those funds to underwrite the promotion of the event, to help develop and produce training materials. We're hoping that there will be enough money left over after that maybe provide some transportation assistance for participants. And then once grants do become available for proposals, that we would help with the outreach to communities to make sure that they're aware that those grants are out there and then assist them with their applications. So in a nutshell, that's how we used our report card to help define our work. We found it to be a very useful tool. I'm not sure we would have really kind of directed in this on this particular area had we not had the report card to kind of guide that work. So very grateful for the opportunity to see that data. And with that, I'll turn it over to our moderator.
Thanks, Jim. Okay, we have a few minutes for questions and answers, so I will do this. First question out there was, we had a question come in about the data sources and how information was used and gathered for the indicators in the report cards. So I guess I can go ahead and answer that, and then Sarah and Margo, if you want to chime in. Most of the information, well, you can find all of the information about where the data came from in the full report. Each of the indicators has the sources listed, and most of the information was found either in studies or other reports, or were gathered by other groups, and you're compiling what information that was already out there. And then other sections where the information hadn't been collected yet, we did online research and then outreach to the different state departments to get information from them for those indicators. We had a question come in. So if our organization is looking to make changes based on the report card, which state agencies should we engage with? Sarah or Margo?
I think it depends on the section. So I think for the first two sections, in general, it's your State Department of Transportation. They would be the lead on that. There may be some instances where in working with your State Department of Transportation, they may not be able to proceed. So for example, in the second section on active transportation funding, in general, your Department of Transportation isn't going to be able to come up with state funding for Safe Routes to School. I mean, it is possible depending on how they allocate other dollars, but that may be something that would actually need to be a legislative ask. You may need to work with your state legislature to get funding like that created. Michelle, did you want to speak to the second two sections? I know
yeah, on the core topic areas on looking at active school neighborhoods, and then also state physical activity plan. The state physical activity planning, primarily I would work with your state health department, public health department, since most of those are under kind of their purview. And then on the active schools and neighborhoods, that one really has a mixture, but it may be State Department of Education, also possibly your state parks group. And then a lot of the indicators there have to do with kind of local decisions, but that are supported by overall state actions.
And this is Sarah, just to chime in a little bit on the first section. Complete streets policies at the state level can also be adopted. They can be adopted by your State Department of Transportation, and that's often very important if you really want the State Department of Transportation's full buy-in and implementation of that policy. But it can be good also to have a state complete streets policy that is adopted by your legislature, since that is a kind of a different level of commitment. It has the potential to be more influential and cross more different agencies, certainly has the potential to apply more directly to localities as well. So that's something that you might consider, which is the most politically feasible place to adopt or strengthen your complete streets policy. And the active transportation goals also are things that certainly, are often very appropriately adopted by a Department of Transportation, but you might also see those coming in some sort of public health department related plan.
Thanks, Sarah. Had another question come in about different strategies. So the work being done in Minnesota sounds great. Other thoughts on strategies that local groups might be able to undertake?
Sarah, do you want to start or do you want me to go?
Well, there are really a wide range of different kinds of strategies. And I think that to some degree, the strategies that you adopt are going to depend upon, who your target is, as we were just discussing. A lot of the actions that we're talking about here, as we mentioned in the beginning, we really focus on what can happen at the state level, because it has that potential to reverberate through that entire large geographic area. Sometimes local groups do have the partnerships and the relationships and the clout to be very effective at the state level. Other times, and in many states, we see strategies where local groups try and get a variety of local policies passed, and then that helps them build up to more state action, or helps them be part of a coordinated effort at the state level. So that's also, certainly something that we support and endorse. Margo, you want to add to that?
Yeah, I mean, I think there are a couple of suggestions. First is, I think that these report cards give you an opportunity to really work with a bunch of other groups in your state that maybe you aren't consistently working with. So if there's a good state group already that works on these issues, I would reach out to them and see if they're doing any work in this area that you can help with. If a group like that doesn't exist, perhaps you can reach out to other organizations in your state that work on parks issues and children's issues and see if you can kind of form an alliance to address these issues. And I would start in a reasonable place. You know, it's probably not realistic for you to address all of the report card issues at once, but maybe look it over and target 1 or 2 for improvements. And start there, and then you can grow from there. And the second thing I would recommend is start with your agency first. Have a conversation with them, much like Jim talked about, because there may be ways that they can make improvements in working with you, and they may want to and be receptive to do that. So start there first. If you don't get good receptivity, that may be where you turn to your legislature. If you've got lobbying capacity, you could also potentially do a media campaign, call attention to the safety issues and the needs for walking and biking, the health benefits, and that these are the kinds of things that our state needs to do to make improvements. So again, a lot of strategies. Those are just a couple of ideas. I encourage folks that are interested in making progress to reach out to us, and we'll see what we can do to point you in the right direction.
This is Jim. I would really echo that. The coalition work is just so important in this work, because within the coalition, everybody brings their particular competencies to the table. And while we may not be an expert in one area, we can lean on those that are. And then the other thing I'd say about working with the state, they, like in our case, they may have the technical advisors available, but there could be even, they have dedicated funding that comes from the legislature, and it could be that they're not particularly budgeted to do something like what we're talking about, would be some regional trainings. But that's where we can utilize our resources to help them do that by providing the space and potentially some financial resources just to handle travel and production of materials and the like.
Great, thanks. And I think we have one more question specifically on the indicator, Margot, on HighNeed Communities and the special considerations. So how were HighNeed Communities defined within that indicator?
We left that fairly loose because it is not consistent from state to state how they determine high-need communities. So what we looked at is for the state in question, how they define high-need communities. Are they providing any extra points on the application or setting aside money for high-need communities? In general, it's, what we mean is low-income communities, but again, how the states define that varies quite a bit. So we find in California, for example, they have some very specific criteria. There's 3 or 4 different things they look at to do disadvantaged communities, I believe they call it in California, whereas other states may just look at income levels, or the Title I schools, for example, often are a way that state departments of transportation look at need when it comes to safe routes to school. So again, it varies state by state, but what we found is that many states didn't have any special criteria for disadvantaged communities or low-income communities, whatever you want to call it for the state, whereas others did. So those are the types of things we were looking at.
And this is Sarah. It's just worth pointing out, I think, that it's quite reasonable that different states might have different definitions because different conditions are present in different places. So it might be something where we might have minimum criteria for that, but we wouldn't necessarily want to have a uniform national standard.
Yeah, I think the important thing in that criteria is that for states that got points there, that they have actually looked at what are the needs in the community and tried to figure out how to get the grants to those that are in the highest need.
Great, thanks. It looks like our time is just about up. Just wanted to remind you that there will be a recording of the webinar available on our website in the next couple days. We'll also be sending out a quick survey, and we really hope to get your feedback. It'll be sent via email. And I really want to thank all of our presenters today. Thank you, Sarah, Margot, and Jim, and thank you for all of us for being here. We'll see you next time.